Bladder Botox. Botulinum toxin injections. FDA approved for overactive bladder. It's FDA approved for a lot of things, including migraine, I believe. So we use a cystoscope. That's what this person here is holding. A cystoscope's a little camera that goes into your urethra. Here's what he's seeing. He's inside the bladder. She's inside the bladder, I should say. And this is what it looks like on the inside of your bladder. And we inject about 1 cc systematically throughout the bladder to paralyze that muscle around your bladder that's contracting and causing you to urinate completely. I like bladder Botox. We can do it in clinic with you awake. I can do it asleep if you really don't want to do this awake. It lasts 4 to 6 months, but if it works too well, the risk is that you don't empty your bladder well enough and you can't empty it and need a catheter. And if that happens, it's usually temporary and only for a couple of days. I think this is a great option, and it's one that many people don't know about, especially if you want to avoid taking medication. It's very effective. Summary of this slide is 50% of people had a 75% reduction in their urinary symptoms. Meaning half of this room, if you all got bladder Botox, half of you would decrease your urinary symptoms by 75%. It's pretty effective. Peripheral nerve stimulation. So I showed you the spinal cord and brain physiology that leads to the storage and emptying of bladder. The point of that was to lead to here, to show why does stimulating my tibial nerve down in my ankle help me urinate less. And it's because it overstimulates S3, the sacral nerve, and causes it to sort of decrease firing on your bladder and help you relax your bladder. There's no incisions with peripheral nerve stimulation. This is an external device. Some folks have one and they can do it at home, or typically it's done in clinic. Stimulates the nerve down here, and then hopefully you get decreased bladder symptoms. I don't think this is that effective. To be honest, we don't even own one in our clinic. It's quite cumbersome. 30 minutes in the office, 1 time per week for 12 weeks. It's time consuming and it doesn't last very long after you stop. This, however, is effective. Sacral neuromodulation. So similar physiology in that the sacral nerve is stimulated to decrease bladder contractions. It's sort of, you can think of it like a bladder pacemaker, if you will. This is a 2-step surgical process, so it's a little bit more invasive than peripheral nerve. First step is temporary leads are placed under the skin into your sacral nerve. We use X-ray to insert this near your sacral nerve, and it's taped to your back. So after this first step, you'll go home for a week and you'll do bladder diary and see if it's helpful. Because prior to us implanting this in your butt cheek, we want to make sure it's going to help you. So if you're like, wow, I love this, I'm not, I have a 50% decrease in how frequent I'm urinating, then the second step is that you'll have the permanent implant placed in your butt cheek, this part, and depending on the the battery length will determine how often the battery needs to be changed, but it's not that often. And this can be very effective. This, depending on the urologist you see, they either are a frequent proponent of these, or you won't hear about it at all. So my goal is just to let you know that this is out there, and it does help a good amount of people. However, it's more invasive, but still, it's not a major abdominal surgery or a major surgery, but it does require surgery.